Action.
So our group focused on the infant mortality rate in Pakistan. Okay. So Pakistan is officially known as the Islamic Republic of Pakistan, and it's a sovereign country located in South Asia. It's the sixth most populous country in the world with a staggering 182.1 million people. As of 2013, the official languages spoken in Pakistan are English and Urdu, with a literacy rate of 64%, and Islamabad as their capital. So Pakistan's infant mortality rate currently sits at 56 deaths per 1,000 births, which is a lot compared to the United States, which is only 6 deaths per 1,000 births. And Pakistan is ranked 26th in the world for the amount for their infant mortality rate, but ranks number 1 in the world for the amount of deaths that they have during the first 24 hours of life of an infant. So this just goes to imply that Pakistan is very unprepared for the difficult situations and problems that are being thrown at them during the first 24 hours of life of an infant.
Okay, so now we get into our solution. So our proposed solution would be to work closely with the NGO, National Government, or Non-Government Organization, excuse me, World Health Organization. So they would send a delegation of trained medical staff to help educate the Pakistani hospital system on how to run an efficient hospital, and also equip them with proper incubation systems and vaccinations. So some things our solution would address. I just mentioned the technology portion of things. Then World Health Organization, International Red Cross, organizations like this have already made great efforts in countries like Pakistan to eradicate diseases like polio and HIV/AIDS. So we attempt to work closely with them on that aspect of things, and then to educate the Pakistani bureaucracy on the overall improvement of or benefit, I should say, of a improved healthcare system. So we get our finances largely from the World Health Organization, so they would provide the transportation and labor for their medical staff, and then they would pick up part of the tab of the incubators and the vaccinations. The Pakistani government would step in on the other portion of that. So a couple statistics for you. Only 47% of children in Pakistan are properly vaccinated. So the World Health Organization considers them Eastern Mediterranean. So they sit currently in 2015 in just above Africa in total vaccination rate, which Africa is obviously very, very low, mostly third world countries. And then the change from, this actually illustrates under 5 mortality rate, but the change from 1990 to 2013, so Pakistan, this illustrates Pakistan in green, India in blue, Bangladesh in red, and a multitude of countries in orange. So Pakistan was second in the South Asian region in 1990 and has climbed to first by a hefty margin in 2013. And then they compare it to the healthy life expectancy rate, though Pakistan only has 57 right now. We have some faculty at Berkshire that are older than 57.
So some training and practices that we need to teach the Pakistani medical hospital staff. One would be how to administer a heel stick. And a heel stick is basically a blood test that you give the baby within the first 24 hours of their life. With this blood test, we get to analyze the babies and make sure that they don't have any immediate health concerns. And also we get to make sure that the baby does not have any diseases that were transferred genetically. Another thing we can teach the Pakistani hospital staff is to conduct home visits. And a home visit is basically like a checkup on the baby at home after the baby's born. And you make sure that it's living in sanitary conditions, that it doesn't have any illnesses, and that it's living well. So, also, some obstacles that we will face with our solution. One would be government acceptance. Integrating this much medical technology on such a large scale would be nearly impossible without the consent of the government, so we just make sure that we have the government's permission. And also, non-governmental organizations alone will not be able to fund the Pakistani hospital system, so we need the continued financial support from the government in order to succeed. Another obstacle would be accessibility for those living in remote areas. People living in remote areas do not have the same access to medical treatment and vaccinations as those living in urban areas. So that's a challenge that we need to face.
Thank you.
Thank you.
Were you guys able to find any data about what percentage of births are happening in hospitals as opposed to in people's homes?
It was a very low rate because, like I said, a lot of people live in like remote areas in Pakistan, and when people live in urban areas, it's very compacted.
So that 47% vaccination rate was actually an aggregate for the whole country. So in urban areas, it's about 70%, but in rural areas, it's in the high 20s. So that leads us to believe that there's very few, if any, hospital births just because of logistical concerns. They're not able to get themselves to the hospital because it's so far away.
Right, so I guess the question then is, are we dealing with, one, I thought it was great, I think, in terms of coming up with solutions and identifying like problems, I think that's great. And the question is, are you necessarily dealing with an inability of the healthcare system to take care of people? If you've got a population, over 6% of the population isn't even seeking care anyway. This is a wide-ranging assumption, but you can assume that 6% of people aren't living in urban areas, and they're probably not seeking what we would consider in the first was conventional medical care. Are you dealing with necessarily a healthcare problem in terms of like inability to offer services or inability to reach people? Are those two different problems or the same problem?
I think you're absolutely right when you're saying that they are two different problems, but I think we can lump them together pretty easily. With the existing staff that the Pakistanis already have and our World Health Organization staff, I think we can easily do outreach programs and things like that to get people where they need to be to have their children.
Mm-hmm.
So I think with the added just numbers and the added equipment, because they're really, really underprepared. I mean, one of the main concerns is 24 hours, first 24 hours like we mentioned. So
right.
If they're being born and then so they're first in the world in that, so that means they have 220,000 infants die each year from that, which is completely staggering compared to even to number 2 in the world. So I think we try to address what's in hospitals right now, because as far as I could see from the data that we've researched, those were documented births that they were talking about. So while undocumented births are absolutely a problem we need to address, the bigger problem at hand, it looked like alright, these are births happening in hospitals and we're not even able to keep them alive for 24 hours.
I'm wondering about money. I know that the United States sends, I don't know how many billions of dollars per year to Pakistan and the other NGOs involved. It sounds like you'll need more. You have a sense of how much more and where it's gonna come from.
A specific amount you mean, or like, alright.
Well, I mean, we plan, like, for most of it to come from the NGOs, but I mean, I guess, like, since we had, like, plans to, like, send, like, medical troops to Pakistan, like, obviously, like, I guess they would be getting paid for the work that they're doing over there in Pakistan, but, I mean, with, like, a specific amount.
I would say if we had to ballpark it, probably $3 to $4 million would cover the first getting off the ground, purchasing the equipment, things like that. Because after that, it's really just upkeep of the equipment and obviously replenishment of the vaccinations that we're talking about. But the incubation, as long as they know how to properly attend and service the incubators, they have them for as long as they can use them.
Good job.
Gentlemen? Yes. Thanks, guys. Well, good job. We'll see you this afternoon.
Thank you.
Yeah.